that they don't teach you about when it comes to endometriosis. And I'm going to share some of the things I was taught as a medical student and as a doctor when it comes to endometriosis. Endometriosis is the presence of tissue similar to the lining of the uterus, so endometrial-like, located outside of the womb, or otherwise known as the uterus. Endometriosis lesions are different in both structure and behavior from the normal endometrium, which is shed during a period. Endometriosis tissue can cause pain, infertility, and impact the other organs in the pelvic area and how they behave. So, for example, your bowel, your bladder, your ureters, even your kidneys and your womb. And this is all due to inflammation, invasion into the structures in the body from the endometriosis, and it causes scar tissue as well. Endometriosis is a lifelong, all-over body inflammatory condition. This article from Praveen Parasar is really interesting because it defines endometriosis as the presence of endometrial glands and stroma-like lesions outside of the uterus. I was taught that endometriosis is a benign condition. And in fact, I still go to meetings sometimes where it's referred to like that. And that is utter rubbish. This paper from 2015 shows that those with endometriosis have a higher incidence of ovarian carcinoma, autoimmune disorders, and cardiovascular disease. Yes, so I go back to the fact that it is an all-over body condition. So the race should really be on to get a diagnosis. When I was at medical school, I was taught that 1 in 10 women are affected by endometriosis and 1 in 3 women who have endometriosis are affected by symptoms. Both of these bits of information are wrong and incorrect. It's more likely that 1 in 7 women are affected by endometriosis, and just because someone does not have symptoms, it doesn't mean that the adhesions and the endometriosis lesions aren't growing. The severity of symptoms does not necessarily correlate with the extent of lesions. So you can have a spot of endometriosis tissue and be in agony, or have stage 4 endometriosis and have little to mild symptoms. If you do anything, please believe women. It's not just a period, and track their symptoms. There are over 20 symptoms of endometriosis. Please pause the video just to have a look at all the symptoms, because it's not just painful periods or heavy periods. It's nausea, it's diarrhea, it's rectal bleeding. It could be rectal fullness, blood in the urine, pain with the bowel movements, pain with urination, postcoital bleeding, so pain after sex. It can be pain during sex. It could be at the start of, so superficial or deep penetration. It can be fatigue, bloating, vomiting, back pain, excessive urination, getting up in the night to pee, leg pain, constipation. There are a whole load of symptoms. I've even had women who are saying to me that they feel anxious or fatigued all the time. That is all part and parcel to be considered symptoms. I actually recently picked up a patient with endometriosis and her symptoms were blood in the urine. And here's the other kicker in the teeth. By tracking the symptoms, the woman might be sent for an ultrasound scan, but a normal ultrasound scan does not mean that there is no endometriosis. The NICE guidance on endometriosis encourages a gynecological referral. Preferably a BSGE accredited endometriosis center is where the patient should be referred to. And this is because endometriosis is diagnosed laparoscopically by the visualization and preferably the histology confirmation of endometrial glands and stroma outside of the womb. Now here's the thing, visually endometriosis can vary from clear, white, red, even tan and black correlations, and therefore they could even be really small blister-like formation or polypoidal masses. It depends on who's looking and the skill of the person doing the laparoscopy to know whether they can visually be confirming the diagnosis of endometriosis. Hence why sometimes some patients get told, yeah, we did a laparoscopic look and actually it was normal. You still follow the symptoms to understand the level of the lesions, it means, and then you can have targeted treatment options and also preserve organs as well as the patient's fertility. There have now been multiple studies that have shown that the inflammatory effect of the endometriosis goes beyond the growth of the lesion. This is why a complete excision of abnormal tissue is the gold standard treatment. And this is done by removing the endometriosis tissue, often permanently by surgically cutting out all the disease at its roots. This is the best way to preserve organs as well, your gut, your bowel, your bladder, as well as fertility. Now I know referrals in the NHS are really low. As an NHS GP myself, I really struggle with the wait times that we have in gynecology at the moment. Therefore, telling my patients that I'm giving them medical management such as pain relief, so that could be mefenamic acid or tranexamic acid to help the flow of the menstruation, hormonal birth control such as Depo-Vera or the pill or even a Mirena coil, all that will do is manage symptoms. It doesn't treat the endometriosis. Medical therapy is an important part of endometriosis care. I will do some more follow-up videos about treatment options for endometriosis.